Hi everyone, I'm Dr. Tess and welcome to our RHA virtual event. You're here at M Beauty Clinic and I want to encourage all of you to stay till the very end because I'm going to be doing a live Q&A. I will stay to answer each and every one of your questions, and of course, if you stay till the end, you may qualify for our raffle, and we'll also announce our attendee-only specials. So please stay till the end. You'll love it, you'll learn a lot, and we'll have a lot of fun. RHA fillers are hyaluronic acid and the first and only FDA-approved hyaluronic acids designed specifically for dynamic wrinkles and folds. Now, what are dynamic wrinkles and folds? Where these are lines and wrinkles and folds that are created when we're moving. And the traditional fillers were not designed for that. And so the lines that you see when you're talking, you're smiling, you're animating, you're expressing, RHA are really designed for those lines. And so we're really excited at M Beauty Clinic to bring it on because this will just add to our armamentarium of fillers to offer and to customize for you. As you know, here at M Beauty Clinic, we really are always looking for the cutting edge and most advanced technologies to really optimize our patients' treatments. We also are huge about customizing treatment plans for patients, and that goes with fillers. And so there are many patients that need different types of fillers depending on what they need. Some people need structural support and restoration. Some people need volumization all over. Some people need recreation of the jawline, the cheekbones, and some need filling of individual lines, and some even need individual filling for acne scars. And some need a combo of both, of all of them. And so what we love about RHA is that it gives us flexibility and we're able to customize the treatments for the patient so we can get the very best results. I feel like anyone who needs a filler can be a good candidate for RHA. The patients that come to M Beauty Clinic want natural looking results, and that is what we stand for. That is what we believe in. Looking your best, but not looking like you've had work done. And RHA is really perfect for those who maybe are nervous that they may look different, that they may look unnatural with fillers. Those who've had fillers in the past and may want their fillers to last longer, Also, those who've had fillers in the past and maybe felt like it was too heavy, it didn't move, or it made them look unnatural, RHA will allow fillers to look very natural, and it is designed for dynamic wrinkles and folds, like around the nasolabial folds, your lips, your upper lip, your chin, the cheeks, where you really animate and move a lot. And so all I can say is that RHA is perfect if you want to have fillers done but look absolutely natural. The beautiful thing about fillers is that it's instant gratification. So it really is like magic, and especially when done well and expertly done and artistically done. And we believe here at M Beauty Clinic, those are the kinds of results that we deliver for patients. And so when you come in and have your fillers done, immediately after the treatment, you will see improvement that hopefully you will look at the mirror and say, wow, and you'll love your results immediately. Obviously, there may be some swelling involved, and swelling may happen over the next few days. It's also normal to have a little bit of lumpiness just from the swelling and inflammation. In about 2 to 4 weeks, everything will settle, and that will be the results that you'll have for many, many months. After your fillers, we will apply vitamin K cream on your skin, and we will send you home with some. We also encourage you to ice the areas to minimize swelling and bruising. We use AccuVein technology, which is infrared technology, to identify veins under the skin to minimize the risk for bruising, and so that patients will have minimal downtime with this procedure. If you're having your lips done or areas around the mouth, those are areas that tend to bruise more, and so plan for at least about a week where you don't have any major celebrations, occasions, or events where you have to look perfect for. We use cannula technique to deliver fillers all over the cheeks, and with a single opening, we can revolumize and treat the entire cheeks and jawline and around the mouth, and so that technique also minimizes your risk for bruising and downtime. Also, remember that for 24 to 48 hours, you really want to minimize strenuous exercise because that will increase your bruising, and as well as you may want to skip alcohol during the 24-48 hours after your treatment to minimize bruising as well, and try to sleep on your back to decrease inflammation and swelling in the areas. RHA fillers typically last about 50 months. The studies show that it can last longer than your typical hyaluronic acid fillers, which can only last 9 to 12 months. So that also makes it very attractive to our patients, because not only are you getting natural looking results, it can last you longer. Now, some patients will metabolize the product faster. If you are losing weight, you also may see that the results may diminish faster, and so your results may be less than 15 months, but on average it can last you over a year, and you can look natural the entire time. Alright, so we have our patient here. Her name is Crystal. She's gorgeous. But I'm going to have Crystal look in the mirror. And Crystal, tell me why you're here. What are we going to address today?
I have a little bit of scarring from some cystic acne on both of my cheeks, and I would just like to plump that up and make it look a little bit better.
Okay. And then, do any of the lines around the mouth bother you as well? Or?
Yeah, a little bit right here and here.
Okay, and then you're also very fit and very slim. And as we all age, volume of the face really goes down. And so that's kind of working against Crystal being healthy, slim, fit. because that volume actually contributes to plumping the acne scars. And you probably have noticed as you've gotten older that the scars have gotten worse. Is that true? Okay. So what we're going to use today obviously are RHA4 and RHA2, and it's really nice because we can customize it for Crystal, because what I want to do for her is use RHA4 more for structural support of kind of lifting and plumping the cheeks, provide a little bit, like I said, of volumetric improvement everywhere there, and that's kind of our goal today. And you can see that when that happens, that adds some structure and support to the scars, and the scars will improve. And then what I'm going to do is use RHA2, which is a finer product, and this can be injected very superficially. And so I'm actually going to inject RHA2 directly underneath the areas where she has scars, and then also do that directly underneath some of the very superficial fine lines around the mouth. Okay, so it will be a layered approach, and that's what we do here at M Beauty Clinic. We really look at the patient, what the issues are, priorities, and then we can customize what types of fillers we can use, because each filler has its own characteristics and properties that we can use to really create amazing results for the patient. Okay, ready?
Yeah.
All right. So Crystal has already numbed, right? We put some topical numbing in here. At M Beauty, we really care that you are comfortable as a patient. So we have extremely strong numbing cream. And if you're really nervous, we also can have you use the nitrous gas or laughing gas anesthesia, and that will allow you to be a lot more relaxed. If you're nervous about the shots, injections, needles, all of that, we can make you comfortable. So here at M Beauty Clinic, we care about your comfort. We also care that we decrease your downtime, so we try to minimize bruising and also obviously make the procedure safe. So this is the AccuVein, and this is a tool that we use. This is infrared, and you can see these lines, dark lines here, are blood vessels. And we really want to avoid hitting the blood vessels, because when you do, the patient will have more bruising, and obviously also you can have major complications if the filler ends up being in these vessels, and it can create a lot of major problems, so we want to try to avoid it. I'm going to use a cannula, so what I'm going to identify here are the vessels, and then also look for a safe place where there are not a lot of vessels, and I'm going to mark it as X, and then that will be the area where I'm going to go in with the cannula. So what I like to use, some injectors will use a cannula, some injectors will use needles. So I use both combination. A cannula, will make a little tiny opening, and then this little tube here, the opening is all the way to the tip, but it allows me to enter through one area and then reach the entire cheek, essentially, from the sides to the mid cheek to around the mouth with one opening. And then I'll save the needle if there are small little areas that I really want to perfect. But this allows me to do a global volumization without having to poke the patients many, many times. So here we go. So you'll feel a little poke here. Cannula's in, you can kind of see where the tip of the cannula is there. So at all times I know exactly where it is, and this is RHA4. It's a beautiful product because it blends so well. And again, I'm using RHA4 a bit deeper just to give a nice structural support to the areas that have lost volume over time. And again, because our patient is very fit and slim, There's lost volume. And if you come close up now, you can see that the acne scars already are looking better. You don't look as deep. And volumization is really important with scars, especially acne scars. So that looks better. And now I'm going to just go here, mid-cheek. She doesn't need a lot there, but again, just to balance everything. And this will also improve the lines around the mouth. And so this is RHA 4. And I'm going to show you, Crystal, we're not done yet. Just part 1. That's the mirror. Can we get the mirror, please? Let me erase this now.
Oh yeah.
Right?
Yeah, it already looks better.
You see a difference?
Color.
And smile. See?
Yeah.
And so I'll put the RHA 2 around here and then more superficial there, okay? All right, and then we'll be finished.
Okay.
Easy? How was it?
Mm-hmm.
All right, good. So now I'm going to switch to the RHA 2. So now I'm switching to RHA 2. Again, this is intended for more superficial injections, more superficial treatment. And I'm going to inject some using the same opening around the mouth and then a little bit here. And I'll probably use a needle to treat that there. So through the same opening, turn away from me a little bit, Crystal. So with fillers, the person's technique, your injector's technique, is like the most important factor in how everything ends up looking. The products now are all great. RHA really allowing us to have very natural results with dynamic movement too. So I'm going to try to inject some RHA 2 more superficial here. Right there, where she has her deepest scars. You can see the tip of the cannula there. And just a little. And the beautiful thing about RHA 2 is you can really blend it. So you don't have a lot of areas you can have lumpiness because it's such a fine product. You can really see how much better that looks already if you go close up. See how superficial we are there. But you're able to do that with RHA 2. So RHA 2 is really beautiful for superficial lines around the mouth. You can see we're finished here, and I'm just massaging so everything blends in, and with just that one opening, we're really able to correct a big area of the cheek there. All right, take a look, Crystal.
Oh, so much better.
Right? It's a little red just because I've been rubbing it, but even this area.
So much better.
And smile. There you go. So now that cheek's elevated. You have some natural volume, and if you even close up, if you go close up, you really don't see the scars as well. And then I'm just gonna go with a needle and just add a tiny bit more RHA 2. Just to blend it in. And of course there are a lot of different treatments that we can do for acne scars besides fillers, but volume plays a big role with scars because the plumper the skin, the less noticeable the scars. Okay, take a look.
Oh, it looks so much better. Yay!
Right?
Yeah. Yeah. Yeah.
There you go.
And I didn't even feel that.
You didn't feel it? Yeah, that's even the best.
Thank you everyone for joining us for the RHA virtual event.
So it's very important that you check your email to make sure you're not one of the raffle winners. Check your text and reply yes. This is really, really important because we'll be able to share with you all of the attendee-only specials, and also you can book your consultation. You want to do that. And finally, stick around because I will be answering all your questions. There will be live Q&A after this. Thank you.